This kind of hot weather lands thousands of people in the hospital every year with heat exposure, and heat waves kill more people than any other natural disaster. So GMA medical contributor Dr. Marie Savard is joining us this morning with some quick tips on how to stay safe in this heat. Good to see you. Thanks for coming in.
Hi, Deanna.
There are some obvious tips we hear every year, every summer there's a heat wave, but it's worth repeating and reminding to our viewers at home what they are.
Right. First of all, heat and humidity is a dangerous combination for all of us, especially seniors. But three quick things: lots of fluids, primarily water or very dilute sports drinks, let's say. Staying out of the heat and getting into an air-conditioned place if you can, or get a senior in there. And then third is just don't exercise. Use common sense, and even don't exercise in the early morning hours if it's very humid. No way to get that heat off your skin.
You mentioned drinking lots of water. We've always heard that, but I think most people are inclined to go for something cold. You say that's actually the wrong thing to do.
That's true. A cool drink is fine, but a very cold drink can give you stomach cramps. If you think about it, your blood is circulating to your skin in order to get rid of that heat. It's too busy. You don't want to distract it. And in fact, you'll get cramps, and it makes you feel very uncomfortable.
And from water to food, there are certain foods we should avoid during the heat wave, right?
Well, there are. I mean, in general, you should eat a small meal, certainly not a heavy meal, and not something that's hard to digest. So avoid those heavy proteins, especially high fatty foods, and stick to simple carbs: fruits, vegetables, cereals. Cooler, easier foods to digest.
And this stood out to us because I think a lot of people should pay attention to this, especially elderly folks at home that are taking medications. There are some medications that do not work well in heat waves, right?
That's right. There are a few medications that are a big red flag, especially for seniors. If you're on a water pill, or if you're taking a pill, something called a beta blocker for your heart, like tenormin or atenolol, they can actually further impair your ability to sort of get rid of heat and make you dehydrated. Talk to your doctor about that. And there are other two categories. If you're on an antihistamine, especially Benadryl, the older ones, or things, other pills like sort of antidepressants, a number of other medications that can really impair the ability to get rid of that heat. Things like Elavil, the old-fashioned antidepressants.
Okay, some very important tips. Dr. Marie Savard, thanks for coming in and telling us this morning. Stay cool in this heat.
Yes.